What's up, everybody? Aloha Monday to y'all. Aloha Monday. Whenever I feel like I'm on a roller coaster, um, I play that intro. I was looking at the charts today, the numbers, and it's a roller coaster, man. Peaks and valleys, and I don't think the end is near with BA4, BA5, and uh, BA 2.75 and BA 0.5.21. Yeah, anyway. You guys know what I'm talking about. Welcome to the show, guys. Welcome, aloha from all over the country. Gosh, I see my dad from Seattle. We see people from the Big Island, from all over. So appreciate you guys tuning in, whether you're on Facebook, YouTube, LinkedIn, or Twitter. If you guys on YouTube, please subscribe to the channel. Helps the channel out. Gets us more. They put us on top when people search for certain things. So if you haven't already, Uncle Manny, what's up, man? If you haven't already, go ahead and head over to right after the show. Go over to YouTube, search Mel Raposo, and then click that subscribe button. Again, it helps us get more exposure for our messages that we think is so vital. I'm not sure how many of you watched the Star Advertiser Spotlight today with Dr. Todd Allen. He's the Chief Quality Officer over at Queens uh, Health Systems. Oh, Jesse, sorry to hear that. Your mom just diagnosed with COVID. And she's in the hospital. Sending prayers out, please. Prayer warriors for Jesse, Jesse's mom. Again, I don't know. Some people, our leaders, are so excited that our numbers appear to be declining. Yet, I mean, you just got to Google COVID numbers and look at all the current articles from experts around the world. Every single one of them is saying the same thing. Buckle your seatbelts because this next surge is going to be a big one. And but you don't hear absolutely nothing from Hawaii. You notice that? Absolutely nothing from our leaders. Like COVID is gone. Anyway, guys, I watched the spotlight today um, with Dr. Allen, and it was a great segment. In fact, I'm going to play it tonight because I know a lot of you don't have the opportunity to watch that during the day. So it's a half an hour. Go ahead and play that with our good friends. Uh, what's his name? Suji. I gotta write them down. Ryan Suji and Yunji Denise. Great hosts. They asked some really good questions, and this doctor was pretty spot on. I think he talks about, and you'll see. I added some little subtitles whenever I felt he was trying to drive home a point. But we're not over. COVID is not over, and he talks about the struggles in the hospitals. He'll talk about that. He'll talk about the what he doesn't address is the new variants that are out there in India and I think many of the other countries, the BA 2.75 and the BA 5.2.1, which appear to have the characteristics of being much more infective and possibly more severe, but it's just too soon to tell. That's the scary part, right? So while we in the state have pretty much, our the leadership have pretty much forgotten about COVID and just encouraging people to go on their merry way, there's an opportunity for us to slow the invasion of these variants into our state. Um, but the government ain't going to do it, so we got to be careful. We got to make sure we protect ourselves and our loved ones so we can at least get this thing under control. We don't want to see, you see, what happens is the more this virus spreads, the more opportunities it has to mutate, more opportunities it has to create more mutations and more variants or subvariants. And I think that is what the doctors around, the experts around the world, are very concerned about. Even the World Health Organization came out with a statement saying, we're watching it because the characteristics make it concerning. And I think that's what we gotta. I hate to, we get accused of being fear mongers all the time, but that's not the point. The point is, you prepare, right? You see the hurricane coming in, right? Darby or whatever Darby's name is coming across the Pacific, and they're already telling people, hey, probably not going to hit us, but be prepared. Um, they gave up on the warnings for COVID, and we're in the middle of this hurricane called COVID-19. But you don't hear them. I mean, you get the commercials on TV for we'll get vaccinated, get boosted, but the campaign to get people to wear their masks, the campaigns to get people to stop attending large gatherings indoors has stopped. I mean, completely stopped. They're at the airport celebrating the new arrivals of thousands and thousands of international visitors every day. They're celebrating that, but yet no warnings coming from our state. So, we're going to have to live with the consequence. So we obviously we are going to have to take it in our own hands. Um, yeah, COVID. My pop says, Mel, you're right when you say COVID is not over. I see a lot of COVID here in Seattle. That's why I wear my mask every time I go out. I lost my love, and that's why I tell all my friends to wear your mask. Yep, pops. I mean, you're a living example, right? You lived it, and it continues. I see a lot of COVID here on Kauai. I get a lot of messages from people, and I really, uh, I enjoy it. I enjoy getting the messages. I appreciate people asking me questions about COVID or isolations or quarantines or testing. You know, because they have nowhere else to go. Right? Where do you go? I mean, you go to the State Department Health website, you get all these numbers, and you get the narrative that oh yeah, the numbers are coming down, positivity rates coming down, um, yeah, deaths going up, but it's a byproduct of success, I guess, in their mind. So anyway, I'm gonna go ahead and play the spotlight. Um, and then we'll come back on afterwards, and we'll talk about the takeaways from Dr. Allen. We'll talk about what his concerns are, and his suggestions for going forward. It's a really great piece. I appreciate the Star Advertiser doing this. It's sometimes it's fun to watch the politicians come on, but when these experts are on, basically validating what our experts are saying that we have on this show, it just makes me feel better, makes me feel like our information is genuine and legitimate, and it really just goes to show how our leadership just not listening to the right people, plain and simple. So anyway, guys, here we go. Ryan Suji, Yunji Denise, and Dr. Todd, I got to keep looking at my notes. Dr. Todd Allen, Chief Quality Officer, Queens Health Systems.
Good morning. Thanks for joining us here on this Monday morning. I'm Ryan Kalei-Suji, joined by Yunji Denise, and this is Spotlight Hawaii on the digital platforms of the Honolulu Star Advertiser. This morning, to start off the week, we are focusing our conversation on COVID-19. This, as a new variant, continues to make its way through the country, causing concern by those in our medical community.
That's right. Hospitalizations are up nationwide. Right now, there are over 31,000 people in the hospital across the country. So what does that mean for us here in Hawaii as more and more people seem to be testing positive for the virus? Joining us live now is Dr. Todd Allen, Chief Quality Officer of the Queens Health System. Doctor, good morning.
Good morning. Thanks for having me on.
Thank you for being here. Let's talk about first hospitalizations, because we know that our leaders really use that as an indicator for how to implement COVID mitigation measures. What are you seeing in the hospitals here in Hawaii at this time?
Yeah, hospitalizations from COVID continue to be up. They're down from their heights of this particular surge, what we're calling BA2 surge. They're down a little bit. We have about 58 hospitalizations across our system. Today at its peak, it was about 85 to 90 just a couple of weeks ago. That's still less than the 140 that we saw as a record in the first wave of Omicron and back in Delta.
Let's talk about this new variant, the BA5, and just the difference that we're seeing with this variant compared to other forms of the Omicron variant that we know really hit Hawaii hard just a little bit ago.
Yeah, this is a real remarkable variant, and we're still learning about it. It's relatively new, but it is the most different from the original strain by far of any. And it's even further different from Omicron 1 than Omicron was from that original Wuhan strain. And it's really a bunch more infective than what we've seen before. And consequently, because it's different and because it's more infective, it's kind of getting us all again, even weeks or just short months after maybe we had Omicron 2. Major differences in the spike protein, major differences in the rest of its genetic sequence. So really easy to catch again, and almost like a brand new virus. We're going to have to be careful with this version of the virus. We're going to have to think a little differently about how to mitigate it and prevent infections. And we're going to have to act differently, I think, as a community and as a nation to help keep the infections down. Now, that said, with Omicron and with COVID now, it's less about preventing infections because it's so infective, and it's more about keeping people out of the hospital and especially about keeping people from suffering and dying.
Well, let's talk about you mentioned that this is basically like a whole new virus. So what about the protections that we do have, when we talk about immunizations, boosters, and then of course people having so-called natural immunity from prior infection? How does that all stack up against this new variant?
Yeah, great question. And I think it's, led to a confusion in a lot of folks. And they say, well, if I'm going to get it, if I got it, what good was the vaccination? Well, first of all, the vaccines designed against that original strain still remain pretty effective against hospitalizations and death. And that's important. That's really important. Now, I do think we're going to see new vaccine versions come out that are more customized to Omicron, and that will be a big step forward. And think of that a lot like the seasonal flu vaccines that we have every year, right? The flu is a little different as it travels around the globe, and scientists and vaccine manufacturers try to make their best assessment of what version of the flu we'll see in any particular place, and then they customize on a yearly basis that vaccine. I think we'll get to that place really with COVID. Um, what we do know is that previous infections and the vaccine, and especially the boosters, all contribute to make your body better able to mount an immune response, to make antibodies against whatever version of the virus comes, and to make them quicker. And that's the thing, right? Is you can get infected, you can get this big viral load, but your antibodies ramp up pretty quickly too. And it's in that production of those antibodies and the circulation of those antibodies that they attack and destroy the virus. And that's what is making part, Omicron, even though lots of infections, leading to less hospitalizations and especially, less ICU hospitalizations. So every bit matters. Natural immunity, vaccine-derived immunity, it all matters. It all helps your body do the thing it was designed to do. The challenge with catching COVID, and sometimes I hear people say, oh, I'll just go catch it then and I'll get naturally immune, except for the complications of COVID. They're really serious, and we're still beginning to understand that. And long COVID, increasingly prevalent, increasingly common, you do not want it. I talk to patients with long COVID, even mild versions where the symptom might just be fatigue. You don't want it. So vaccines, I think, are still the best and the safest way by far to teach our body to recognize the virus so that if it does get us, we're able to quickly mount that immune response and have less severe disease.
What would you say about those who are waiting to get their boosters? Maybe they're saying that they want to get a booster that will include some of the protection against some of these new variants. At what point in time might it be a good idea to go out and get this booster? Would you recommend that people wait, or is this something that it should be done immediately?
Yeah, I would do it now. I totally get that question. It's gone through my mind dozens and dozens of times. I don't, it's still far enough out and it's still uncertain enough. And BA5 is among us. 4 and 5, I think, accounted for 20% of the viruses last week in Hawaii. I'd be surprised if it wasn't double that this week or by the next measure. So I would do it. When we figure out what the next version of the vaccines look like, terrific, and we'll have good recommendations on that. But there's enough uncertainty around it now that I would go ahead and get that booster. It will be helpful.
We like to bring in audience questions, and George White has one. He says, what differences in approach have improved our response or management after 3 serious surges of uncontrolled transmission in 9 months and now facing BA5 and whatever's next? You did mention that we might have to change and adjust our behavior and how we approach COVID with this new variant. What specifically should we be doing differently?
Yeah, a couple of things I think, and it's thanks for the question. And it really has been remarkable to look back at those surges. As a country, I think collectively, we quote decided, that COVID was over, and that there didn't have to be restrictions like we had lived through before. I think a part of that was wise. There are economic consequences and social consequences and psychological consequences to the lockdowns that were necessitated by COVID that we've got to start to take into account. What we can still do is be more collective with each other. And by that, I mean, let's wear masks again when we're outside, when we're indoors, excuse me, and in crowded rooms. Let's stay home if we feel sick, and let's monitor our symptoms. Let's do home testing as the kits are now available. Different behaviors that can help us have a better sense of if COVID is in us, if we're being affected by COVID, and to protect ourselves from COVID when we're out, and to protect others from COVID when we're out with our behaviors.
Well, one of the things that, as you mentioned, many in the community are getting COVID and they're taking home tests. And for those that get that positive test, many wonder what they should do next. I'm on a text string with some friends, and there seems to be, some of those who get infected. There seems to be just a variety of thoughts and principles about what you're supposed to do, how long you're supposed to stay, in quarantine. If you can sort of break that down for anyone out there who may get infected, what is the recommendation at this point in time about how long they should remain in quarantine and some of the other things that come along with those who may find themselves in this situation?
Yeah, great question. The CDC has kind of muddied the waters here, and it's a little discouraging, being a physician and an administrator here at Queens. So first of all, let's acknowledge that we're really lucky now to have home tests. They're not perfect, those antigen tests, they're not perfect. Boy, but what a terrific tool to have in our armamentarium versus, the PCR test that we had to line up for, the big deep swab in the nose, and it takes 3 or 4 days sometimes, at least in the early days, to get this test. So we're lucky to have them. We should all have them in our house. If I had symptoms today, first thing I'd do is I'd say, well, COVID's by far the biggest virus in circulation right now. It's not allergies. It's probably COVID if I feel sick. I'm going to isolate. I'm going to take myself out of circulation. I'm not going to put other people at risk. Now, that COVID test, that home antigen test, which I hope, again, we all have, most accurate probably if you have symptoms and probably about 2 days into it. Early on, I've seen lots of reports of what we call false negative. So I actually have COVID. Because the virus isn't circulating heavily in my body, it's early in that infection. I take the test and it's negative. I think, okay, I'm fine. I can go back out there. It's not. If you have symptoms, give yourself at least 2 to 3 days to run that test again. And I've done, I've recommended to family and friends 2 tests about, every 36 hours apart, 2 or 3 tests about every 36 hours apart, really to have a sense. If that thing ends up positive, I think you're still stuck in isolation, should be stuck in isolation for 10 days. Now, the CDC moved it to 5 if you are asymptomatic. The problem is you're still shedding virus most of the time at 5 days. Not all the time, but most of the time. In fact, the symptom that you can shed from as low as 3 to as high as probably 9 to 10 days. So what the CDC actually said, and we missed the second part of this, is, isolate for 5 days. The second part of it was wear a mask for the next 5 days if you go out. And we didn't hear that part. We just heard, hey, I'm free at 5 days, and here we go. So I would still stay in Queens. Our habit is that it's a minimum of 7 days. And then we very closely call those caregivers, nurses, respiratory therapists, pharmacists, physicians who are positive, and we say, okay, it's on day 7, how are you feeling? Do you have any symptoms at all? And if no symptoms, then we'll do some testing again. And if that's negative, bring them back to work. So minimum of 5 as the CDC recommends, but only stop it if you're asymptomatic. And even if you're asymptomatic, wear that mask for the next 5 days. I prefer longer. I prefer 7 to 10.
Let's talk about folks who do get that positive home test and may be immunocompromised, maybe elderly, may have another condition, or may just feel really poorly. What are some of the options in terms of, we've heard about monoclonal antibodies and Paxlovid. What are some of the treatments available and how soon do we need to get those? How do we actually get those treatments if we think we might need them?
Yeah. Well, look, 5 and 10 years from now, when we look back on this episode, I think we're going to be amazed at how quickly science and medicine and government and so many people made progress on a brand new virus that we'd never seen before without any diagnostics, without any therapeutics at all. So we should be, there's some good news to be shared there, right? Vaccines we've mentioned. For treatments, we've got some pretty good tools. I think we'll get better tools as we go along. The outpatient treatment you're referring to, if I'm not sick enough to be in the hospital, it's called Paxlovid. It's a combination of two antiviral drugs brought together that you take typically for 5 days. So if I was older, it's actually approved for use for those above 12 years of age. If I were feeling symptoms and I had a cough and I had mild to moderate infection, I'd probably just try to get started on Paxlovid, like you mentioned. Now, to be most effective, it ought to be started within 48 hours of symptoms is best. Within 4 days of symptoms is okay. And yet, again, you take it for 5 days. Now, the antibodies that can be taken, there are two types. There's monoclonal antibodies that we can treat you with, essentially antibodies from people who have had COVID. And we infuse them very carefully under close observation. And just like your own natural antibodies, they'll glom on to the virus and fight that infection. So we can use that. If you're at high risk and you need protection, there's a medication called Evusheld. It's a collection of antibodies that are long lasting. And you can have that given as a preventative measure if you're at high risk for complications of COVID, and can offer some protection as well. For the inpatient, if you're sick enough to get in the hospital, there's some other medications that are used there. Remdesivir, an antiviral you might remember, dexamethasone, a steroid that helps tamp down the inflammatory response, that heavy immune response you sometimes get with COVID, and some inpatient antibody medications as well. But Paxlovid is the mainstay of our outpatient treatment now. We're getting better at distributing it. It's been hard to come by. Recognize that shortcoming in our response. But there are a few drug-drug interactions. People with kidney disease and liver disease should be careful. But this can be given, I think, really quite safely with the supervision of your physician or pharmacist.
Given all those medications that you listed off, including those that you administer to those who unfortunately make their way to the hospital, we are also seeing still a number of people who are passing away due to complications with COVID-19. I'm wondering if you can shed some light about some of those individuals. Is there any trends that you're seeing with medication that's not working for those individuals? Are these all individuals that maybe were unvaccinated or suffered from another medical condition that COVID kind of put them over the edge? What are we learning about where we're at right now with the deaths that we continue to see related to COVID-19?
Yeah, the story of the deaths from COVID is just so tragic. Recall back in the summer and the early fall, 100,000 Americans each week were dying of COVID. It's now down to 10,000, and we say down to, and we take that as some measure of comfort. 10,000 Americans still dying a week of COVID. We saw at the height of Delta, about 10 citizens of Hawaii died in our hospitals every week. And we're now down to 3, only a third of that, 3 people a week still dying of COVID, here. And so it's still really among us. The people who are in the hospital or sick now are mostly vaccinated. They're the elderly, our kapuna with some chronic illness, think about heart failure, think about kidney disease, think about diabetes, lung disease. So our elderly who are largely vaccinated, over about 60% of those in our hospital are vaccinated. And it's because, again, Omicron is just different. Immunity wanes. It's different enough where people get infected. And again, when you're a little older, have chronic disease, it can sometimes be quite severe. It's not that they've tried and failed any particular therapies or they have, anything else really is part of the story. It's just that Omicron is still COVID. COVID is still quite serious. And even if, again, if you have the vaccination, um, it can be very severe. Gratefully, though, again, nowhere near the numbers that we saw at the beginning of the pandemic with Delta and beyond.
One of the things that, some good news that happened in the last few weeks is that Keiki under 5 can now get the vaccination. What are you seeing with the uptake of families in terms of people actually going in and getting their children, their young children vaccinated? And what do you say to parents who may say, oh, I just want to wait a little longer. I want to see what's going to happen to the classmates, or, oh, it's not that serious in kids and we don't really need to vaccinate. What do you say to those folks?
Yeah, I think the same advice. I think parents are really considering their options thoughtfully and carefully. They're making the best decisions that they can with the facts that they have in front of them. That's the way healthcare, should be, is that providers and systems sit down with patients and families and carefully discuss the risks, the benefits, and the options, and then make the best decision. Now, I think the best decision here is for the vaccination. And as a system, we'll say that. As an individual physician, I'll say that. There has not been the rush amongst children less than 5 that I would hope for the vaccine. I remember when I received my first vaccine, I remember in those first days that we offered the vaccination clinic first on Blaisdell, first here on campus, and then at Blaisdell, literally, actually tears of joy from people. And I had my own tears. I'd hoped for a little bit of a more urgent response from parents for their children who are less than 5. We're getting a steady stream each day. We're delivering really at 3 main clinics, branching out to 5 and then to more pediatric clinics and other clinics. No complications, no problems thus far that I'm aware of. And I try to keep pretty well attuned to that. But I'd encourage folks to sit with their physician, their pediatrician, and talk carefully about the options, the risks, the benefits. Again, it does look like it's a different disease, a milder disease in children, except when it isn't. And we have yet to understand the long-term complications of COVID, even in our pediatric population. That's what we're trying to prevent, at least in part, with the vaccination program for now, really all Americans.
Want to bring in another question and asking, are the symptoms of BA4 or 5 different from other variants? Are we seeing any different responses from this as we see these different variants come out due to COVID-19? Have we seen different symptoms that people are suffering through as a result of that?
A little bit, yeah, very interesting, right? So I think when you look again back on the Delta wave, that was devastating. It was unbelievable suffering, unbelievable death. The virus for Delta and those early variants had a particular affinity for the respiratory tract and the lower respiratory tract, the lungs. Now, COVID, BA4 and 5 still do, but a more of an affinity for upper airway symptoms. So the runny nose, the light cough, the sore throat, the scratchy throat, more of affinity for nose and throat issues. So we have seen a little bit of shift from lower lung, which was what caused the death in the Delta surge, to now the upper respiratory symptoms. It's still associated with a cough, but a little less prominent. And that's the biggest symptom change that I've seen.
I want to circle back to kind of where we started with the hospitalizations and also the hospital's ability, the Queen's Health System and others in our state, to handle the influx of patients. We focused on the patient population coming in, but the other side of the coin is having enough workers. And we know with so many infections, surely there are exposures in your system and people who need to stay out. So given how prevalent this variant is at the moment, are you able to staff to the needs that you have? Do you have to bring in traveling nurses? We heard so much talk of the federal help early on with these other surges. How are you doing from a staffing perspective, given all the exposures to COVID?
Yeah, great question. It's really been remarkable. Short answer is no, we're still behind and we're still struggling. Not as much as we were in June, but still struggling. The story of Omicron, has been just as you described. If Delta was about, death and just the real difficulties associated with how much suffering there was. This one is about workforce, because our workforce was getting COVID, especially once the restrictions came down in the community, mask wearing and allowance of gatherings. Our workforce was getting COVID just like everybody else. We then are doubly obligated to be careful and keep those folks out of work. We can't afford to give a single patient who has sought our care COVID while they're in the hospital. As it happened, it has. And we take every one of those things very seriously. So we keep the workers out. And so consequently, we were down at any given time in June about 300, 400 workers just out of the workforce. You can't bring in enough travelers to close that gap, but we did. And we still have travelers with us today. They're slowly coming back. The tide is slowly turning where we have more coming back to work than going out of work because of COVID and exposure or infection each day. But it has been a struggle. One of the most challenging human resource problems that I've seen in healthcare ever in my career, and by a long ways. So we've still got some work to do. I know this is true across the state. I would get on calls with other leaders from across the state, and every hospital was affected by workforce shortages. It's something as Hawaiians we're going to have to work at over the long term if we transition, and we have to transition to COVID sort of being among us in some form or another, at least for the next 5 years. And as we continue to learn to adapt it, the workforce strategies are something we're going to have to figure out as well.
Beyond just the physical impacts of COVID-19, as you just spoke about, to the impacts of your workforce, I'm wondering if you can share a little bit just about the emotional and mental, well-being of your employees. I mean, this has been a long 2 to 3 year process for many of them, long hours, of course, the early going times of COVID-19, and seeing all that our healthcare workers were going through. I'm wondering how just the staff overall is holding up, and just being able to retain some of these workers to continue to push through, especially when we continue to see these new variants coming up, and knowing that this work is not yet over.
Yeah, thanks for asking. It's disheartening. It really is. On one hand, I certainly recognize how great nurses, physicians, shared clinical service workers, housekeepers, nutrition support, pharmacists, therapists have been during the entire two years and change now. When they went into those professions, they went in to serve, and they've honored those service obligations. On the other hand, they are tired, they're worn out, and some days it's hard to go on as we speak together. As we saw Omicron 1 sort of settle down, and then Omicron 2 pop back so quickly, and now Omicron 4 and 5 kind of get melded into the end of 2. When you're on calls, when you speak with your colleagues, you can hear the exhaustion, you can hear the fatigue, and you can hear the discouragement. Like, I just need a break. We need a break. We need to go 2 months without COVID just ringing in our ears incessantly. And the fates won't hand it to us is really disheartening. So we think about our caregivers, our colleagues every day. We try to support each other. The public's been terrific. And we want to continue, to do the things that are necessary to continue to have the support of the public, civic officials, and our families, so that we can continue to slog through. Relief has to come at some point. We have seen at Queens, like in other places, people just say, I can't do it anymore, and leave. I think there'll be more of that to come. Many are still working out of their ethical obligation and ethical commitments they made to serve patients as they again entered the healing professions years ago.
I think that the sentiments that you're talking about, a lot of people feel that not necessarily in that severe way, but just across the community, you feel this fatigue and this declaration that we're done with COVID. COVID is POW, but COVID clearly from our conversation today is not over. In just the last few minutes, just as the final question as we wrap up this morning, What's your message to the community as we face this new variant? What are you asking folks to do, and just your message about this next phase?
Yeah, I'd say two things. Number one, recognize that uh, the hospitals are functioning, they're functioning well. But when you come here, there's going to be some different rules because of what we're trying to do. It's not the community, it's a hospital. It's a place where people who are sick and vulnerable come to get cared for. And so, we're still asking about your vaccination status. We're still having our guests wear a mask. We're still limiting visitor hours and the number of visitors in total. It has to be that way still. So please understand and have some forbearance on that. Work with us, talk with us if you have concerns. We want to hear them, but we're going to have to keep things tight for a little while to protect, again, the vulnerable who are within our walls. Number two, as COVID and BA5 and 4 come through the community, do those things we talked about earlier. If you feel symptoms, take yourself out of circulation and isolate. If you're exposed to someone who you know has COVID, take yourself out of circulation and isolate. Please wash your hand. Please wear a mask as much as you can. And test. Do that home testing so you can have a better sense of whether you're positive or negative, and then take the appropriate actions. We have got to be good stewards of each other. We miss that time and time again in COVID thus far. It'll be, again, one of the great stories of failure, frankly, as a society when we look back on it. But be good stewards of each other, especially, as BA5 and BA4 get going in this community. And they will. We're going to see our infections go up, just as you described, in the rest of the nation.
Okay, Dr. Todd Allen from the Queens Medical Center. Thank you so much for spending the morning with us and starting off your week by providing that information and update about where we're at with COVID-19 in our community. We appreciate the conversation and all the insights, and look forward to maybe having another discussion down the line with some much better, brighter news to come in the future. But thank you so
Yeah,
much.
thank you. There is good news to be found out there. We just have to be careful still. And thank you for the time. I enjoyed it.
Aloha.
Thank you
Thanks
so much. Well, Ryan, he was fantastic. If you missed any part of this conversation, remember when the live broadcast is over, you can go back and rewatch it. Also available later this afternoon, anytime as a podcast, and later on the rebroadcast of Channel 50. But so much information throughout our conversation about what to do if you test positive. He had some really good points about the fact that the CDC is recommending 5 days of isolation after you show symptoms, but that there is a page 2 to that. And the page 2 is that if you still feel sick, stay home. If you don't, you still need to wear a mask for an additional 5 days after that. He said that's something that's really gotten lost in the messaging. Talked a lot about the treatments that are available, and there are more and more of those that are available, and also encouraging people that if you're eligible to get a booster now.
Yeah, you heard that recommendation from him saying not necessarily to wait to see when a new booster will include some of the immunity against these new variants we're seeing, but rather that a booster should be taken sooner rather than later, than waiting for that. We also just heard the breakdown of some of the differences that they're seeing with this new BA5 variant, and it's spread through our community as we're seeing across the country and across the globe, with this becoming the new, more dominant strain. And it's difference between what we saw with Delta in the that it is in more affecting the upper respiratory area. And so we'll see a little more, as he said, runny noses, cough, sore throat, maybe than what we saw. Still a cough, but maybe not as much of a deeper cough. He also reported just the numbers and what they're seeing in the hospitalizations overall. People continue to die. He's saying about 3 deaths a week continue to be what we're seeing here in the islands. But overall hospital counts continue to remain manageable at this point in time.
Yeah, and very interesting also when he said that what people assume is natural immunity from having caught COVID doesn't necessarily hold up against this variant. And even vaccination, it can prevent hospitalizations and severe illness and even death. And so that is very important. But he says that this is basically a new virus under this new variant, and something that we really need to be careful for. He's highly recommending masking up in an indoor situation, even if it's not mandatory, just as a precaution for yourself. Also recommending that parents get their young children vaccinated. He said he's been disappointed with the uptake of the vaccine for those under 5, recommending that parents talk to their pediatrician and make that decision for themselves, but they're not seeing the rush that they had hoped for in those young kids. And he also referenced long COVID, which we're going to have a deeper discussion on Friday about. We've invited a doctor here, also part of the Queen system, who has done a lot of research into long COVID and helps to run their long COVID clinic. We're going to be taking a deep dive into what long COVID really is and what you can do to prevent it. So looking forward to that conversation on Friday.
Sorry, I was muted. Let me start over. I want to thank Ryan Suji and Yanjit Denise. Obviously, it was not live. It was from this morning's spotlight on the Star Advertiser Facebook page. So I hope you can hear me now because I did unmute myself. Can you hear me now? Sorry, guys. You guys are paying attention, I see. All right. You guys should be able to hear me. But I'm gonna wait till I hear someone tell me that you can hear me, because okay, looks like now you can hear me. Okay, now you can hear me. Yeah, so a lot of information in a half an hour session. I think Yanji and Ryan, they do a really good job, and our friend George White, who's on there, and he always asks his question that they don't ask mine. I wanted him to respond to the new BA 2.75 and 5.21. I just don't think he had the time, but those are two variants. I suggest you guys go check it out. It's I think something that we gotta really watch out for. But I mean, real quick, some takeaways from today. Hospitalizations continue to be up. Everyone keeps comparing the numbers to what happened months ago, but what he said, that it's still up. And I guess before I go on, I just kind of, is it just me, or you folks feel like the messaging from our experts, this is the chief quality officer at Queens Health Systems, right? So he runs, or he takes care of all of the Queens hospitals and clinics. Is it just me that thinks that it's quite opposite of what we're hearing from our state leadership, from our Department of Health? The other one is BA 5.2.1. 5.2.1. Yeah, it's bizarre, and it baffles me how you can listen to a guy like this, who's very non-political, very unbiased. He's just stating the facts, but yet you sense the concern in his voice. You sense the concern, and he shares some subtle messages that obviously he's gotta be professional as well. But a couple of the things that he talked about, this is more different than any other strain we've ever seen. The most different variant than any other strain we've ever seen. It's a lot more infective. It's a brand new virus in essence, is what he's saying. And he says we have to think and act differently as a nation. In other words, I think that's a hint, a clue that we got to think and act differently. And if we cannot think and act differently by ourselves, then maybe the government needs to step in, right? Because this is some serious stuff. I also like the part he talked about a lot of the confusion, over the years, but he interestingly talked about people saying, "Oh, I should just go catch it." I loved his response. Basically, in a nutshell, he said, "That's not a wise thing to do because COVID is really serious, and you don't want to catch it." So I know my good friend, his doctors suggested that he go out and catch COVID. But again, I don't know of any medical professional that would advise that. And I think he kind of validated that. He also talked about getting your boosters now. And I know there's a lot of questions, and I apologize for those that came on late that may have thought this was live. So obviously could not ask him any questions. I will try to get him on the show. I don't have any pull at Queens, but I know some people that might have. So I'll try to reach out and have him on our show. But he talked about how important it is to get the booster or get the vaccine if you haven't had it. Um, he said another thing, right? He said, our country, and he said, quote, he said, our country, quote, decided that COVID was over, unquote. Um, I mean, there's no more truth than that, right? Our country and our states decided that they were going to move forward and just pretend that COVID was over. And that is very true here in Hawaii for sure. Because, see, we're unlike most of the other states. Now, there are some states in our country that rely on tourism, but we are different because we have this, we're separated by the ocean and, 30, 40,000 people a day coming into our state from all over the country now. So, yeah, our country and our state decided that COVID was going to be over, right? For economic reasons, for special interest reasons, and that was wrong. And I think he said that. So what did he say? Right, three things. Number one, wear masks again. He's giving our leaders some hints and some clues. Stay home if you're sick, and take advantage of the home testing. We all know about the home testing. We all know that it's not 100%. We all know that you sometimes get a false negative. And I love what he said about that. I'll get to that a little bit. But he said the CDC muddied the waters, and it was very discouraging when the CDC came out. And because of special interest, now I don't care what, anybody can argue, anybody can want to debate, let's go. I'll give you the code. You can come on this screen and we can debate. That whole reduction of time from 10 days to 5 days was a direct result of the lobby from the airline industry. We know that. I mean, we know. We all saw the letters from Delta Airlines, right? Went to the president, went to the White House, said, hey, you guys are killing us. We're canceling flights. We got to reduce the time. We got to get people back to work sooner. Now, what? I mean, really? And they did it. And the consolation or the compromise was 5 days, and then wear 5 days, wear a mask for 5 days after that. Not mind testing, just 5 days and 5 days of isolation and 5 days of masking. And like he said, everyone forgot about the second part of that. Everybody now, they're testing, they get the negative test, and they're out on the street. Or if they got a positive, 5 days and they're back to work, still infectious. His recommendations, and this is, again, when we listen to experts and not politicians, we get the true story. He said home tests are not perfect, but it's the best tool that we can get, right, for right now. And his recommendations is you take a test if you were exposed or if you have some minor symptoms. If you take a test and it's negative, take another one within 36 hours later. 36, that's his recommendation. 3 days. Or 36 hours, I'm sorry. 36 hours, and you test again. And if you're still sick, you got to assume that you have COVID. Just because the amount of virus around, bingo, right? You just got to assume you have COVID and you stay your okole home, away from people. His recommendation, if you test positive, isolate for 10 days. 10 days. Of course, the CDC, again, thanks to the special interests, went 5 days, and we all know how devastating that was. It's interesting how when all of these things change, when these changes happen, the spikes occur, right? At Queens was very interesting. He said when they have to focus on keeping the sick employees away from the hospital, away from patients, because they got to protect patients in the hospital, whether they're there for COVID or not. So he said for Queens, minimum 7 days. You isolate at home for 7 days. If you have no symptoms, they test you again. Before they make a determination whether or not you can come back to work, you will test again after a minimum of 7 days. Now that's responsible. But you see, again, how can the state and the counties and everyone else just totally ignore these types of responsible actions and just focus on getting people back into the workforce? That is why we cannot kick this thing, because the spread is constantly happening. It's constantly happening. He summed it up by saying COVID is still very serious. But again, if you listen to the media, you listen to our leaders, you never get that. No, you don't. In fact, you get the total opposite. You get the message that it's safe, business as usual. All of our experts have said 5 days is far from enough time. 5 day rules are purely, absolutely, Lauren, absolutely. I mean, we called it when we saw it. We saw the letter from Delta. Yeah, you can thank Dr. Reed. And of course, you have that voice. You have a doctor in a policy making position advising the governor who has no clue. And that's how you end up with the state moving forward with these types of policies. The other thing he talked about is he hasn't seen that rush for parents to get their the young pediatrics vaccinated, the young ones, the little ones. And he's kind of surprised. I'm not. I'm not surprised because of the messaging from the state. You are convincing the people that it's safe. You're convincing the people that it's mild. You're convincing the people that nobody's dying and very few people in the hospital. So why are you going to put a vaccine in your kid's arm when you're hearing from the state? Now, if everybody listened to this doctor, that's why I'm hoping that that's why I played it tonight, because when I look at the numbers of people watch the Spotlight, we get more viewers on our show. So I wanted to put it on, and I hope I don't get busted for copyright, trademark violations, but I don't think they'll mind sharing that kind of information, because if everyone could hear this doctor, if everyone could hear Dr. Dworkin, and by the way, Wednesday we have Dr. Lee Altenberg to come on and discuss the numbers for Wednesday, but they're not getting the messages. They are listening to our state, they're listening to our media, they continuously hear the stories about how mild this is. Why would you go give your kid a vaccination if it's a mild thing like the cold? I don't get it. But this was what he said, and this is what's concerning. And I think it's this been on our show. It's been a very um, concerning topic is long COVID. And he said they're trying to prevent long COVID in patients, even our pediatric patients, because we don't know. He said he sees the patients, the long COVID, from mild symptoms to major. And that's what they're concerned about. They're concerned about long COVID. That is why they're strongly recommending that these little kids get vaccinated. Now, this one here, I think hit me the hardest. Uh, and when he talked about the staff, the workers, um, and I know we have some healthcare workers on right now, our villagers. We have many villagers that are working in healthcare, and they have been doing this for over 2 years. And they have been doing this. Some have gotten sick, some have burnt out, some have left their profession. But when you listen to every stinking leader in our state, and especially our lieutenant governor, the question is always about the hospitals, and he always says that the hospitals are doing fine. Oh, I talk to my colleagues all, and no, we're doing fine. The hospitals are doing fine. Governor Ige, oh yeah, we're monitoring, but we're managing the hospitals. Okay, you all say that. All of you in the state policy making organizations called the capital, the executive branch, and the legislative branch are saying hospitals are doing fine. Now, this guy is from Queens Health System. I'm not sure how many hospitals they have. I'm not sure how many clinics they have. But I know one thing: Queens is one of the top hospitals in our state. This guy is the chief quality officer. I would take his word over Dr. Josh Green any day of the week, who works one shift a month out at some rural hospital in emergency room. This guy knows his stuff. And they asked him directly, and I wrote it down. He said, "We're still behind and still struggling." That was his words, not mine. I ain't paraphrasing. We are still behind and still struggling. And that's where he said he's obligated to keep sick people out of the hospitals to protect the patients. But he said there were times there were out 300 to 400 workers at one time, and they rely on traveling nurses, and they still rely on traveling nurses. How can you sit there and tell me that we're doing fine when we're relying on travel nurses? No, we're not doing fine. When I hear Dr. Allen say we're struggling, it breaks my heart, because the message from our leaders, again, to the parent of the 4-year-old or the 6-year-old, or the ones that have made the decision, we're not going to vaccinate our kids because it's fine. The hospitals are fine. Nobody's dying. And he talked about 3 patients a week. And I know Ryan said in our islands, he was only referring to his system, which is the Queen's Health System. We all know last week 20 people died. I don't know how many it's going to be tomorrow or Wednesday when they show the sign, show the numbers. But he said he talked to his colleagues across the state. Every hospital is affected and struggling, is what he said. And I'm sorry to have to repeat, but I'm trying to get some takeaways for all of us so we can really appreciate what this guy was saying. He talked about how disheartening it is that the situation with these workers that came into this profession to help people, and they came in with they have this mean obligation to take care of people. I listen, man. I could never be a nurse. I could never be a healthcare worker. I was a cop. People say, I don't know how you could be a cop. Well, I can be a cop. I could never be a healthcare worker. I could never be a nurse or a therapist or anything like that. He said these people went into service to help. They went into service to serve people. And then now they're in a situation, again, and I hate beating a dead horse, but I will. They watch the news and they hear these clowns tell them that the hospitals are doing okay, and they are tired. They are worn out. They are exhausted. I'm just reading my notes. It's difficult for workers and healthcare workers to carry on. They want to give up, but they have this commitment to service that keeps them there. You can hear the exhaustion, the fatigue, the frustration. This is coming from the Chief Quality Officer at Queens, but that's not just at Queens. I can tell you, that's at Wilcox, that's at KVMH, that's every hospital, every single hospital across the state. You heard it from Dr. Allen. He talks to colleagues across the state, every single hospital, and yet our leaders can sit there with a straight face and tell us that the hospitals are fine, they're managing well. Why do they lie? Why? So they can go sleep at night? So they can pretend like it's all good, so they can go sleep at night after they lied on the news or in their little political interview or their commercials? Obviously, I'm pissed because I feel for these healthcare workers. I can only imagine what it's like to go in to work and you are just burnt out. I experienced it. I mean, as a cop, after the hurricane, yeah, we worked and I just, honestly didn't think we could go any harder. But it was not for 2.5 years and no end in sight. And we didn't turn on the news when we finally got electricity back, and we didn't hear the media telling everybody how, oh, the cops were all fine. They were getting good rest and they were managing well. Hell no. No. I mean, everybody knew. But in this scenario, because it impacts the message, the false message that they want to portray or want to convey to the public, they just lie. And they tell everyone that the hospitals are doing fine. I can only imagine what it's like to be sitting at home watching the news, hearing this knucklehead tell you that that you're managing well, and you're about ready to walk out or have a nervous breakdown. So, guys, if you're on here, healthcare workers, please know that we love you guys, man, and we appreciate you guys. And that's easy to say. What's gonna happen if they all walk out one day? What gonna happen? What? Just relying on traveling nurses? Just whatever? Is that a adequate replacement? Is that just your answer to the problem? Just go fly in more nurses? Unbelievable. COVID is not over. That was his kind of towards the end. COVID is not over. And he said, we've got to be good stewards of each other. Now, this is the message that we have been trying to put out for years now. We have to be, I like the way he said it. I've never said it this way. I'm going to steal it. We've got to be good stewards of each other. That's the best I've heard anyone say that. We have to be good stewards of each other. And he said, when we look back at this 5 and 10 years from now, we're going to see how we failed in that. Again, I think that's a message to the leadership that you guys had an opportunity and still do to take some action to save people's lives. He talked about masking indoors. He talked about he said we got to start doing it. I put the text on there to reemphasize or emphasize what he was saying. 5 to 10 years from now, when we look back at COVID, we will see the failures in being good stewards of each other is exactly what he said. That's what I heard anyway. Folks, I hope you enjoyed that. I mean, we try to bring on live guests, but when I saw this today, I immediately knew this guy, we need to share this guy as much as we can. We really do. We need to, this is the message we need to get out to the people. Wednesday, we'll have Dr. Lee Altenberg. He'll go over the numbers. He'll go over the numbers across the globe, our country, as well as our state. I really don't enjoy or I don't trust the numbers that come out of our state. I just don't. I never did, but that's all we have. But I do trust the trending numbers that we get from other countries and from other states, those that continue to report every day. I have never seen a system that had so many mistakes or errors or backlogs as in our state. I don't believe anything really that comes under there, but again, that's the only data that we have, so we try to make the best of it. So we'll have Dr. Lee Altenberg on Wednesday, and then on Friday we will have Kimberly Hope. And I love this girl. She's amazing. It'll be a great end to a week. Whatever happened to Dr. Miskovich? Message him and ask him. Yeah, he decided that he was, I guess, not fully. Anyway, yeah, message him and ask him. Yeah, Kimberly Hope will bring us some hope, and bring us some wonderful music and an amazing story on an amazing young lady here in Kauai. So again, folks, we're going to continue to do what we do. As long as we still get villagers that watch, we're still going to do the show. Charlie's been busy. He has been working hard. They've got some situations at the airport. It always happens on Mondays, Wednesdays, and Fridays. It's frustrating, but he's got a lot of responsibility over there. So I'm really concerned about Charlie. I want him to get as much rest as he can as well. So he's doing fine though. He's all good, and he'll be back. He'll surprise us one night, I think. He will surprise us one night. So yeah, we're gonna try it next week. Next week. What is next week? I think next week I go back to Oahu. Um, I get my second surgery for my kidney stones on next week Wednesday. So we'll be out of commission next week Wednesday and possibly Friday. So we'll do what we can to stack them up before then. All right, guys. We appreciate you guys. We love you guys. Again, I hope you guys didn't mind the live or the replay stream, the stolen material from the Star Advertiser. But no, it's all good, guys. It'll be good, and we'll continue to do it for you guys. Keep the words out. The best thing again, you guys can do, share it. Hit the share button. Don't forget, go to my YouTube channel, hit the subscribe button. Next to the subscribe button, there's a little bell icon. Click the bell icon so you get notified whenever we put up new videos. All right, guys. We love you guys. Take care. Stay safe. God bless. As they say.